So a little bit about how this event came to light. So a couple of months ago, Dr. Ismail and I were having a simple conversation about our personal and professional lives. And it was in that conversation that an idea sort of sparked. And we both sort of asked each other, wow, Durham region looks so different. Doesn't look like what it used to look like. How can we connect with, learn from, and give back to the women, the real soldiers of all of our families? How can we give back to them? And another question we asked is, how can we empower them to be their master of their own destiny, whether it's about their own health journey or a career in healthcare, whether it's on the clinical or non-clinical side?
So it was an amazing journey together. I attended a meeting last year. It was the Federation of Medical Women of Canada. And there was a conversation about issues which are very specific to women. And they talked about it and they called it snippets. So it was like 10 minutes about every issue that women face, whether it's osteoporosis, whether it is arthritis, whether it's perimenopause, and all things that we talked about today. But that took me back to my own journey. What you're looking at today is a physician, is a health system leader, who is at the senior leadership team at Lakeridge Health, which is a huge privilege for me. But at the same time, the same person is actually an immigrant from a country which was war-torn. And I immigrated to Canada more than 20 years ago. And it's been quite a journey because you arrive here, you're broken, you're afraid, you have kids. My husband and I were, we spent everything by the time we arrived here. And I remember being pregnant with my second child here in Canada. And we couldn't afford maternity clothes. So I used to wear my husband's shirts throughout my pregnancy. So I've come a long way. And one thing I would say is that I'm looking at some women here, and I think I see the story of immigrants. And I also see the story of cultural shock that we receive here when we come to a new country, a new place, people that we don't know. So that is probably, I would say, the first generation immigrant, if you will. And here is the second immigrant.
So similar to Dr. Ismail, I am a second generation immigrant. And so what that looks like for me is that my parents, they were forced to flee a war-torn country, what we call Tamil or northeast of Sri Lanka. And because of some of the sacrifices that they were forced to make, I now have the opportunity to really pursue a life of freedom, ambition, and so-called peace. But as whether you're a first-generation immigrant or a second-generation immigrant, one thing that rings true for all of us is that this pursuit of freedom, it comes at a cost. And oftentimes, that's your mental health. And for many immigrant communities, communities of color, or equity-deserving communities, as some would like to call it, there's that generational toll for when it comes to mental health, or the impacts of just generally what generational trauma does to you. And so I say this because my family and we went through the same thing in different ways. And growing up, it didn't also help that on the mainstream media or in corporate boardrooms, there wasn't really a lot of people that looked like me or had the same experience as me. And so as a young, marginalized Tamil girl or woman, I could have never dared to dream of a moment where I could be sitting next to one of the most badass women that I know today.
So the journey is not an easy one. It's not, like one day you wake up and you are in this position today. There are so many roadblocks. So whether it is starting all over again, doing your exams all over again as an international medical graduate, moving from one place to another in Canada to basically pursue opportunities and dragging your kids with you. And in addition to that, the generational and cultural issue that we have with our own kids who grew up in a different country. But at the same time, each time, it always reminds me of the resilience of women. We as women are so resilient. And we are so three-dimensional. We can always adapt no matter what. And I think that is, and also when I always remember my mom, I remember my aunts, I remember the generations of women in my family or my friends who came before me, and that gives you a lot of strength to carry on and to stay the course and focus and almost like put a goal and reach that goal at the end. And I feel that, you know, it's a privilege, but at the same time a burden, because you always feel that you need to pass it on. It shouldn't stay with you. It is through mentorship, it's through reaching out, it's through looking at these amazing women here. I'm looking at you and I'm saying, you are the anchor of this society. You are the future of all the new generations which come in. So own your destiny, own your power, make sure that you achieve whatever you want to achieve, and build this community, make it stronger, make it better. And we at Lakeridge Health are here for you, because to be honest with you, when you look at these amazing women who did all these presentations, look at them and see yourself in each one of them. And hopefully, like the new generation that will lead Lakeridge Health will be sitting here among these young women here.